At this stage, we're having a blood substitution. I'm going to take over as the chair to chair Phil's talk. Dr. Phil Scott, I suppose for anyone in the sheep world, needs no introduction. I first came across him in 1996 when he was my external examiner, so he's partly responsible for letting me out in the world. He has a passion for sheep. He spent 38 years in the University of Edinburgh as a clinician, and I suppose he has pioneered the use of ultrasonography as a diagnostic tool in sheep, so he's going to share some of those findings with you now.
Thank you very much, Damien, and good morning, ladies and gentlemen. So what I'd like to do in the next 10 minutes or so is just go through our findings on the appearance and prevalence of fibrinous pleurisy in adult sheep. And I would stress that there's no specialist equipment required, and the images don't look as good as the video recordings. Unfortunately, I can't use my own laptop, so trusting a different IT system to play video is a bit of a risk. So if you're interested in the images, a lot of the video recordings can be downloaded free of charge. There's a recent edition of Vet Clinics of North America which feature many of these videos, and also they can be downloaded free of charge from the internet. So why report this? Well, it's not uncommon to find fibrinous pleurisy, and we can see on the left-hand side of the screen up to 6 centimeters of fibrinous exudate within the chest. Now, would we expect that animal to be acutely ill, or would we expect it to be normal? And what would be the consequence of that infection for the animal? Does the animal maintain that extent of pleurisy, or does it recover with time? We don't really know, or didn't know, until we routinely used ultrasound. Similarly, if we do a necropsy examination, and increasingly more and more of us in general practice have to because of the lack of backup resources, if we find that degree of pleurisy on the right-hand side of the screen, is that important? Is that the cause of the animal's death? So what really stimulated my interest in this aspect of ultrasonography and respiratory disease in sheep is this pedigree ram that was presented with a short history of weight loss and inappetence. And when we examined the chest, on the right-hand side of the screen, you can see up to 10 centimeters of exudate in the chest. Yet this was the animal at the time of clinical examination. Now, anecdotally, I would have said acute fibrinous pleurisy equals pasteurellosis equals sudden death. And that obviously wasn't the case in this animal because he looks reasonably healthy. And over a period of time, this animal was scanned once a week, and we can see quite a dramatic change, which I've never seen before, but there again, I've not had that opportunity to repeatedly scan an animal before. So what we see on the far left is the animal at presentation, where there's more than 10 centimeters of exudate within the chest. Within 3 weeks, that infection is now restricted to a 5 centimeter well-encapsulated lesion. We can see the encapsulation as the anechoic layer surrounding the hyperechoic content. So it could be an abscess, or it might just be an organizing fibrin clot. And then after a further 3 months, that lesion is reduced to a 3 centimeter well-encapsulated lesion. So it's gone from 10 centimeters to almost an insignificant lesion within 3 months. And that is perhaps important when we look at the etiology of pleural abscesses. And a pleural abscess is different from a lung abscess. And on the top of the screen, we can see an abscess within the chest cavity. It doesn't look a very good post-mortem examination, but that's because when we remove the lung, we remove the visceral pleura or lung surface, and the abscess ruptures. So we're left with what looks like a ruptured abscess. But that's important because the abscess there is not within the lung. And previously, we believed, or I believed, that pleural abscesses and pyothorax were a consequence of the lung abscess. Oh, sorry, I'll go. Yeah, I've gone ahead of myself. I'll use this side. We thought that a pleural abscess and pyothorax were a consequence of a ruptured lung abscess, and that appears not to be the case. So, that was the basis of the study. How important is fibrinous pleurisy? We can scan a sheep, one side of the sheep, within 10 to 20 seconds. You don't need extensive preparation, and you get this image very easily. It's so extensive. And when we look at the results, it's not common, or fibrinous pleurisy, excessive pleural exudate is not common. We found it in 3 of 65 adult sheep with chronic weight loss, approximately 1 in 1,000 in adult sheep, and more cases in housed animals with a mycoplasma pneumonia. So just going through a typical case we would find at routine screening of sheep for ovine pulmonary adenocarcinoma is the exudate you see on the right-hand side is the anechoic layer separating the visceral and parietal pleura, and that corresponds very well to the post-mortem examination. This animal was culled for a separate reason. And on the other side of the chest, again we can see the exudate separating, in this case, the chest wall from the diaphragm, but the accumulation of exudate caudally here, which represents this area here between the lung and the diaphragm with the liver beneath on the right-hand side of the sheep. So we get a very good representation of the pathology by ultrasound examination, however quickly. But typically, none of these animals with extensive fibrinous pleurisy showed signs of illness, and this would be another case where the animal appears perfectly healthy with extensive pleurisy. In some cases, we were able to monitor these sheep for an extended period of time, and what happened is the lesion would go from 6 centimeters to 10 centimeters and then to 15 centimeters. But you can see on the right-hand side of the screen the well-defined capsule. So the lesion is essentially space occupying rather than causing pathology via or clinical signs via toxemia. And when this animal was necropsied, we can go back to the ultrasound and we've highlighted the well-established capsule, and we see the same again here. So the lesion is not causing clinical disease, it's causing a space occupying lesion, and here we see it again at post-mortem examination. Again, it's not unusual to find really extensive lesions. This one's 16 centimeters. The heart's displaced to the contralateral chest wall, but the animal's perfectly healthy. The well-established capsule is preventing the animal from absorbing toxin, etc. And again, the chronicity of the lesion is well shown here. And again, the very close correlation between what we scan and what we see. Starting with the PM specimen, we can see the well-established capsule, well-encapsulated fibrin clot, and collapsed lung. So this animal has had the pleurisy for so long, it's reduced in size, but the pressure has caused collapse of the lung. And the lung there looks more like liver. So looking at lambs, again, we can pick up pleurisy very easily. This animal was culled because of incorrectly culled because of suspected OPA, but we can see the pleurisy, antroventral consolidation, and moving on to another animal in the group. These animals were not ill, yet you can see quite readily on ultrasound examination the anechoic exudate separating the chest wall and lung surface, and the same at post-mortem examination, a close correlation. But importantly, there were 4 animals which were not culled and had an exudate fibrinous pleurisy, and after treatment, these animals showed no sign of exudate. So the animal was able to resorb that exudate. There may have been the remnants of a clot, but we couldn't find it. So other examples, really extensive, well-established pleurisy. You can see the extent of the pleurisy relative to the lung, but the patient is healthy. He was part of a screening exercise, yet he managed to live through that extensive pathology. When it came to treatment, we used procaine penicillin because previous reports had described strep discalactiae as the most common cause of fibrinous pleurisy. 3 out of 5 animals recovered. 2 of the 5 did not, but those had well-established lesions at the time. So the reason to report these findings, first of all, ultrasound is very quick, very easy, very representative of what's underneath. And I think with adult sheep, we should caution extrapolating what we see and our knowledge of fibrinous pleurisy associated with Mannheimia hemolytica to the situation we see in adult sheep, where we've got to be cautious with extrapolating from pathology to the clinical significance, and also the extent in some cases to which a fibrinous exudate can be remodeled by the sheep and the animal remain healthy throughout, and this may explain the etiology of pleural abscesses and pyothorax, which are different from lung abscesses. So thank you very much for your attention, and I'll stick to time. Thank you very much.
Thank you very much, Phil. As previously, could you just raise your hand if you have any questions and wait for the microphone before you ask it? Any questions? Down at the back on the left.
I enjoyed your talk. With the case of atypical pneumonia in your lambs, you know, you see quite a lot of it and get phoned about quite a lot of it. And a lot of the time, maybe I'm given the advice of, you know, give them a bit of time. Usually they'll get over it, or, you know, go in with a long-acting penicillin description. Yep. Should it maybe be the case? Maybe we're thinking down the line of maybe the lambs that have lasted longer with that coughing or anything, that potentially we should be going in with a slightly longer term treatment for?
Yeah, it's a very good question, and I hoped someone would ask it. So what I would recommend is you can scan them very quickly. Yes, you can scan them very quickly, and you could see how obvious the pathology is. You can scan them 20 seconds inside of a chest and quantify it. So yes, I would recommend in those treating them with long-acting antibiotics, possibly Oxytet. I'm contradicting myself. But it would see us on the farm. It would be cost-effective because I imagine you only treat 10%. And maybe scanning them after the first straw of lambs when 50% were left would maybe an economic use of the farmer's time. So yes, I think it's a very good question, and I do think it would speed the resolution. And I was surprised by the extent to which these lungs recover. So I'll stick to my time. And
one more question, maybe.
Is there?
Anyone else? Just one there. Or at the very back.
Dr. Scott, I enjoyed your talk. Thank you for that.
Phil,
do you think they've won the battle? Do you think they've won the battle in this? Do you think that could recrudesce into another disease? Or I know you looked at serum proteins. I mean, are they showing any signs of chronic inflammation?
Yeah, that would be a very good follow-up, is to do fibrinogen, haptoglobin, etc. But these were done on farm, and some of them were subsequently admitted. It would have been a very worthwhile study, and unfortunately we didn't do so. As to whether they recrudesce, I think that unlikely, because I think many of them, although we can't be sure, develop into pleural abscesses, and they seem well encapsulated. The image on the bottom right is well encapsulated. So I think the likelihood, we didn't see recrudescence, but none of them really showed clinical signs beforehand. So some of the lesions did increase in size, but were so well encapsulated to become space occupying.
Okay, we'll leave it at that, so thanks.
Great. So thanks, Damien.